Hi,
Correct.
This is Paul Slatkus, Good News Planet. I'm speaking to Dr. Rebecca Brightman. Hi, doctor. How are you?
I'm well, thank you.
Great. I'm also speaking to Linda Dominguez. Hi, Linda. How are you?
Fine, thank you, Paul.
Good. Well, we're going to talk about a very important, if not one of the most important parts and aspects of our whole humanity, which is birth and the beautiful things of life. And what we're going to talk about today is a new landmark survey reveals nearly half of women 18 to 49 report having at least one accidental or unintended pregnancy. Okay, so it's an important subject, and especially if you're in a situation that you don't want to be in and didn't plan to be in. And I'm very interested in this survey and all of us learning more about, having a child. As I sang happy birthday, we sang happy birthday to our 3-year-old granddaughter this morning. So
Congratulations.
we love kids, but we want to plan for them, and we want to be wise because it's a big responsibility. So, doctor, tell us what we're talking about here.
Well, I think the most concerning thing here is that, in our country, despite the fact that we're a developed country, there still are 3.1 million unintended pregnancies per year. And the amazing thing is half of those women conceived at a time when they felt that they were using contraception. So if they're using contraception, they're not using it appropriately, and it's a bit of a wake-up call because we're a developed, well-educated nation with access to birth control, access to many different types of contraception, yet we're still seeing a large number of unintended pregnancies.
And doctor, you're the clinical instructor of obstetrics, genealogy, and reproductive science at Mount Sinai School of Medicine in New York, New York.
Correct.
And we're with Linda Dominguez, who's the chair of the board of directors, Association of Reproductive Health Professionals, past assistant medical director, Planned Parenthood of New Mexico. What's your thought, Linda?
Well, I'm in private practice now at Southwest Women's Health, and one of the things that I see every day in my practice is women that are using a method but not using it correctly or not using it as effectively and efficiently as they could. For instance, birth control pills are the most commonly used method here in the United States, and yet we have this high rate of unintended pregnancies. Birth control pills are highly effective, but they have to be taken highly effectively. And women have very busy lives and very busy lifestyles. So let's just take the college-age woman who has a certain schedule during her work week, her school week, but a very different schedule on her weekend. And yet that pill mandates that it be taken every single day at the same time of day. So we want, with this campaign and also with this downloadable birth control information pamphlet, for women to begin to look and understand other methods that are available to them that may fit into their lifestyle much more conveniently, something that has longer lasting effect for them and yet is rapidly reversible. We know that women want to have a highly effective method, but something that will be rapidly reversible when they are ready to seek a pregnancy, an intended pregnancy.
Okay, that makes good sense. So what are the different forms? I know Ativo Women's Health was behind this campaign. Tell us a little bit about this birth control guidebook. Does that then teach women and men? The men are takes two to tango.
Absolutely, absolutely.
And a man should be and must be as involved as the woman. A man should say, do you have contraception? A man should not be a fool, and it should be a man and responsible and respectful as well. It's
well said.
Absolutely.
So what will the guidebook help us with?
I think the guidebook is really helpful in that it goes through all the different types of contraception, hormonal contraception, barrier contraception, intrauterine devices, sterilization, hormonal implants. They're all discussed. The way in which they act, their mechanism of action is also discussed. And also there's a list of questions patients can ask themselves so that they can get a sense before they see their healthcare provider as to which type of contraception may fill their needs, and then it gives the patients a list of questions they can then take to their healthcare provider so they can best make an educated decision in planning a pregnancy, which may not be something they want right now. It may be something they want in 3 months or 3 years, or they may be done having kids.
What are some of the findings that you found in the research?
Well, the research found that women were using contraceptives regularly but ineffectively, and that's one of the the main underlying reason for the unintended pregnancies. We also found that women had this idea that they couldn't get pregnant, that because they had had sex before and not gotten pregnant, perhaps that's why they were thinking that they couldn't get pregnant. So there's this false sense of security that if they've had intercourse without protection, that they maybe can't get pregnant. So that was one of the findings. I think another finding was very surprising, that, as Dr. Brightman had said, those 3.1 million unintended pregnancies that we see a year, women reported that half of those women reported that they were actually using a method at the time that they became pregnant. There's a big disconnect there between what women believe about their contraception and how they're using it. And I think that probably the most important question that a woman needs to face and look at is just what the name of the campaign is. What will you do? What will you do if you have an unintended pregnancy? What will you do to prevent that? And this birth control pamphlet, this downloadable information, is going to give her, as Dr. Brightman said, the full array of information, including some basic information about her reproductive health, about her body. And if a woman doesn't understand her body, then she can't really understand how that method's going to be working for her.
Correct.
Mm-hmm. What will you do, or what will you do? I'm going to take a half a second before that's a very serious subject. What are some examples? You mentioned, like with the birth control pill, that we women have a week of stabilized lifestyle, but then on the weekend it might not be as stabilized. So that's one way with the pill. What are some of the other things? You don't put the uterine in properly. What are some other things that we can help, at least at this moment, mention?
I think patients need to really realize, first of all, with the pill, they absolutely have to be compliant. They have to take the same pill every day. We now are prescribing lower dose pills, so the window of error is much smaller. And so patients, if you skip a pill, you have to double up the next day. They have to really follow the instructions for the pill and be compliant. If they feel that they can't be compliant, they need to discuss this option. The other thing is with condoms. They need to be used all the time. One mistake can end up with an unintended pregnancy. And I think many, if we're talking about college-age students, these are probably the two most popular forms of contraception. We now know that there are some other forms of contraception that may, in fact, be better for patients where compliance is an issue.
You were talking about the intrauterine device, I think is what you were saying.
Yes.
And the IUD is very simple and easy to insert by providers, nurse practitioners, and physicians are trained to do this very simple in-office insertion. And it's a method that stays with the woman. It's a hands-free method. She doesn't have to do anything or remember anything. So it's an excellent method for a woman on the go and for a woman who wants probably the top-tier contraceptive option.
How about the old-fashioned rhythm method? If I'm saying that right.
It is hard to keep the beat.
Absolutely.
With rhythm. That's the truth. And
explain what the rhythm is, who might not know. Maybe some guy's listening, he doesn't know. What is the rhythm method?
Well, patients who are aware of their cycle, and this is assuming a patient has a regular menstrual cycle, 28 days, ovulating around day 14, and avoiding intercourse mid-cycle. And the truth is, women's cycles can really vary from month to month, and it's not a great form of contraception. It may work for some, but not for everyone. And again, once someone conceives, when they're not planning on conceiving, it's past the point, so it's really not terribly reliable. And again, this drives home the point that patients really need to think about what will they do in the event this happens, because there are other more reliable forms.
Let me ask you just one other thing, and how about I don't know how to say this gracefully, but pulling out before.
Pull and pray.
What do you call it? Pull and
pull
pray.
And pray,
okay.
right.
Help me here, ladies.
Pull and pray.
The guys are the most embarrassed to deal with this, right?
Well, and yet guys are the guys that are doing it.
Right.
And women are trusting that indeed that this is a method or a technique that will be effective. But it's very hard for a man to control his ejaculation when he's at a time of of intense feeling. And, so women who are really not wanting to become pregnant should not be allowing their partner to use that method. He is doing her no favor, because she's now got the anxiety and concern until her period comes, whether he pulled out in time.
Sure, that all makes sense. What other information should we share?
I think the fact that there really are a lot of options. Traditionally, women thought about condoms, birth control pills, and I think that by accessing the website that we referred to, whatwillyoudocampaign.com, that was founded by Women's Teva Health, they will realize there are many different options that are out there that may be best suited for their needs. And again, the needs may vary depending on patient's underlying medical problems, her family history, and her lifetime plan. She needs to plan a pregnancy much in the same way she would plan her finances. But that there are other options, whether or not there are hormonal implants or an intrauterine device, whether or not this woman wants permanent contraception or sterilization. These are all things that need to be taken into consideration.
Okay.
It's the most important decision she'll ever make in her life, is when and if to have a baby, when and if to have a child or more children. And making a deliberate reproductive life plan is the first step in her protection.
And then, which we didn't really address, and I don't think I have the energy to address it right now, is what will you do if you are pregnant? So maybe we can talk about that in another moment, and how people deal with that, and what is the, all the medical concerns and considerations, psychological, and all that kind of stuff. But I think we need more time. Linda, what's good news for you?
Oh, what the good news for me is that there's this great website, this whatwillyoudocampaign.com. Because as a clinician, I can tell you that having correct evidence-based information to give to patients is critical, and that there is this free, downloadable, highly interactive website is a wonderful, wonderful bonus for women here in the United States right now.
Excellent. Doctor?
I think the fact that we actually have reliable information for patients that's very accessible is fantastic, and also that we have more options, and there will continue to be more options on the horizon. And I think that's good news for patients. What we need to really do as clinicians is to open up the dialogue, have patients be aware that options exist, and have clinicians be able to address these options and tailor them to each specific, individual's needs.
Perfect. Okay. Thank you very much for sharing good news with us.
Thank you.
Thank you, Paul.
All righty. Bye-bye.
Bye-bye.